Vaidyaratnam Nursing Home. Vaidyaratnam Nursing Home, the premier center for traditional Ayurvedic treatment, is situated at Thaikkattussery in Thrissur, the cultural capital of Kerala, India.
Welcome to Vaidyaratnam Jnanaveda CaseSeries. I am Dr. Vandana Venugopal, Senior Physician in Vaidyaratnam Nursing Home. Here I am taking a few minutes to share the topic on cervical dystonia. I can give you a quick review on cervical dystonia, its causes, risk, symptoms, diagnosis, and treatments. Now, let's see what is cervical dystonia, also termed as spasmodic torticollis. Is an extremely painful condition, neurological movement disorder, which causes neck to involuntarily turn to left, right, upwards and downwards. In Ayurveda, Vata Kopa is responsible for this disorder. Mostly, causes of cervical dystonia is unknown. Other possible causes are neurological disorders like Parkinson's, use or overuse of drugs or side effects, traumas like injury to head, neck, and shoulders, family history, or psychological problems like anxiety, attention seeking, congenital deformity, and environmental factors. Next, about the risk category. As I mentioned earlier about the environmental factor, that means the extreme winter may trigger the condition. Data shows more than 60,000 people affected in US alone. Women are more affected. People between age group of 40 to 60 and those who are having with family history. People with cervical dystonia have a higher risk of depression and anxiety. Symptoms of cervical dystonia. The pain is the most challenging symptom of this condition, and it usually on the same side of the head as the tilt. 4 types of abnormal movement in cervical dystonia are twisting of head and chin sideways, that is towards your shoulder, torticollis, tilting sideways, that is ear to shoulder, that is laterocollis, tilting backward, chin upward position, that is retrocollis, tipping towards chin, that means downwards, anterocollis. But the most common abnormal movement is torticollis. Symptoms begins gradually. They may get worse and reaches to a point. It will start as neck pain that radiates to shoulders. There will be raised shoulders, hand tremors, headache, head tremor. About half of the people with cervical dystonia will be having head tremor. Enlargement of neck muscles. And unawareness of physical movement that's not affected by dystonia. And stress and excitement may trigger the symptoms. A diagnosis of cervical dystonia is based upon clinical examinations, a detailed patient history, and a knowledge of this disorder. Physical examination alone can confirm cervical dystonia. X-ray can reveal if there is any associated issues like cervical spondylosis, disc herniation, etc. And MRI can also play a role in identifying spine compression, brain atrophy, etc. Electromyography, which is not mentioned here, can rule out the signs of nerve irritation. No specific laboratory images or test can confirm a diagnosis of cervical dystonia, but we can seek the help of such techniques for ruling out any associative problems. This is an MRI of a patient having cervical dystonia. Next, the treatments or how to manage cervical dystonia is by certain physical therapies, mainly targeting on stretching and strengthening exercises, Exercises is to move in the opposite direction of the person, twist. Kinesiotherapy, that is exercises for moving or stretching the neck. Electrical stimulations of neck muscles. Biofeedback, that is a use of an electronic instrument to measure muscle activity, blood flow or brain waves. The other one is a surgery, that is a cutting the nerves in the brain that involve in the involuntary movements of the head. But these surgical procedures may have side effects. Also, the involuntary movement may return. Counseling may help to improve the mental status. Next, we can discuss a particular case of cervical dystonia which has been treated here and got better results. 70 years old male patient from Punjab who was settled in US for 40 years came to our hospital on June 4th, 2016. He was having the complaint tilting of neck towards left with a tremor for over 5 years. Jaw movements restricted, closure of eyelids, while opening he feels strain, tired feeling behind the left ear. There was swelling on the back of neck which was recently appeared. And other associated complaints are low back pain for 7 years, knee pain, heel pain, and having the issue of sleeplessness, and he was having diabetic mellitus, hypertension and dyslipidemia. Moving to the history, rather than having minor issues like knee pain and heel pain, he was perfectly healthy person till his 65 years. Gradually, he developed neck pain with stiffness, rigidity, and later leads to movement restriction. Neck pain radiates to shoulders and sudden jerky neck movements, tremor combined with weakness. Later, he took X-ray and MRI. On the basis of clinical examination and lab reports, diagnosed as cervical dystonia. Consulted orthopedic and neurologist. They suggested for Botox injection in every alternate 3 months. He was managing with this for 4 years, and later body weakness and intolerable pain was noted in January 2016 and admitted in Vaidyaratnam. When he was admitted in Vaidyaratnam, he was undergoing some medications. Benica 40, that's for hypertension, Simvastatin 20 mg, Trica, aspirin, and Botox injection was taken 2 months back before admission. He used to do other supporting cares like yoga, meditation, and physiotherapy, that exercises for stretching and strengthening the neck muscles. These all supporting cares he used to practice daily. Regarding the personal history, appetite, bowel, micturition, everything is normal, and sleep was disturbed, sometimes due to the posture, pain and stress. Since the age of 40, he started his business. It's a sitting type of job, working in computers. It was very stressful, and now he took a break. No relevant family history as he observed. On examination, he was having swollen nodes on the occipital region, mild swelling or tenderness on the nape of neck, and all vital signs was in normal limits for his age with medication for blood pressure. Next, we can move to the systemic examination. In this particular case, rather than laboratory techniques, the clinical and systemic examination plays a major role in diagnosis. On inspection, there was deformity, neck tilt towards left, and drooping of eyelids was there, involuntary neck movements. On palpation, we found a tenderness on the lateral aspect of the neck, nodes present on the back of neck, that is in the occipital region, mild warmth over the left side of the neck. Locomotory examination, in which the jaw movements are restricted with pain. The range of neck movements, in which the flexion, extension, lateral rotation and lateral flexion was restricted with pain and involuntary jerks. Neurological examination, in which we have examined relevant cranial nerves, in which ptosis was noted and all other cranial nerves were intact. Moving on to the recent investigations, radiological X-ray shows spondylosis, that is C4, C5 level. On C4, C5 disc degeneration was there. Thyroid nodule also noted. MRI shows that was taken on 2015 December shows sprain at C4, C5, right thyroid nodule also. Recent blood test that took on April 13, 2016, in which triglycerides was little bit high, 252. Clubbing with Ayurvedic view, there is no direct correlation. It can be considered as Vada Vyadhi, and there are similar lakshanas of Akshepakam and Kampavada. And according to Charaga, Griva Hundanam as one of the Vata Kopa Lakshana, which is the tilting of neck, and it can be correlated with cervical dystonia. Due to age and degenerative changes in his condition, that shows Dhadukshaya. In Urdhva Jatru, there is an impairment of Vyanavayu. Considering all these, we planned Vadahara line of treatment. Internally, considering Kevala Vada, Sahajradi Kashayam along with the Yogaraja Gulgulu tab, as it has the property Agni Dipana and Balavardhaga, we are given as a combination before breakfast. And for tremor or kampa, Kabikachu Churnam given in warm water before dinner. Symptomatic management, just like Ardhida and Akshepaka, Dhanada Nainadi Kashayam with Sahajradi 21 times medicated given after dinner. Now let us discuss about the head oil application. Here, considering Vadahara property, Rasnadi Thailam and Sahajradi 3 times medicated oil was prescribed as a head oil in a combination of 2:1 ratio. From the day 1 onwards, head oil is advised, that is every day evening 1 teaspoon of oil to be applied on the middle of the head and wiped off with dry cloth. Weekly twice, head bath can be done in the morning with medicated water as per the advice of the physician. Regarding the body oil, considering the symptoms, it was planned as a combination of 3 oil: Sahajradi Thailam, Kottanchukkadi Thailam, Karpasastyadi Thailam, based on its properties. As drooping of eyes was one of the major concern, we have given Jeevandyadi Kritam for local application on eyes as it is having a Brahmana property. During the course of treatment, towards the second week, his neck stiffness or muscular spasm got worsened, and then immediately we started Masha Saindava Thailam internally along with Dhanada Nainadi Kashayam. As all know, it is indicated in Sangujidanga, Ashtanga Hridayam, Vada Vyadhi Chikilsa. Also parallelly, we have added Masha Saindava Thailam instead of Kottanchukkadi Thailam in body oil. Next, we can move to the external treatment. On the first day, we have done Abhyangam with the body oil, that is Sahajradi Thailam, Karpasastyadi Thailam and Kottanchukkadi Thailam in equal proportion. And the second day onwards, we started the treatment Pirichal, that is Kaya Seka, with the same body oil, and it's a Snigdha Sweda Karma, which is a Vadahara treatment. Followed by Shashtikashali Pindasvedam with the same body oil for 7 days. In addition to Snigdha Sweda, Brahmana effects plays a role in muscle strengthening. Next, we have done Shirodhara, that means Thailadhara, with the Snigdha and Brahmana property of Thailas that we used will help to bring back the vitiated dosha into its normalcy. Pradeshika Piju we have done for 21 days on neck. That helps to reduce the stiffness. For all Urdu Jatru Vikaras, Nasyam plays an important role. Considering his age, instead of Nasyam, Pradimarsha Nasyam with Rasnadi Mridupagam was performed. For Vadanulomna, we have done Snehavasti with Dhanvantaram Medupagam and Kedagi Muladi Medupagam in alternate weeks. That means altogether we have done 5 Snehavastis in 6 weeks of duration. In rest period, we have done Shiro Piju with head oil for 14 days, follow up of Shirodhara. Then Upanaham we have performed on knees. It is a type of Sveta Karma. With its medicinal properties, this treatment helps to strengthen the muscles and regenerate the synovial fluid. Prishtavasti is another one treatment, that's stagnating warm oil over the whole spine. In this particular condition, we have done on the whole spine as he is having disc degeneration. After each treatment, we assess the patient, and in which after the 7 days of Kayaseka, the stiffness has reduced and neck and back pain persist, and there is a mild improvement in flexibility. After completing the Shashtika Shali Pindasweda, the patient itself observed that there is a frequency tremor reduced, mild improvement in neck and back pain. And after completing the dhara, that he feels there is a strain in closure of eyes, that he feel good improvement in that, and improvement in the frequency of tremor also. So overall his confidence level increased. Nallarikka, the term means rest period. During this period, Abhyangam and localized treatment are carried out. Shiropiju is a follow-up of Shirodhara. For Shiropiju, we have done with Rasnadi Thailam and Sahasradri 3 times medicated oil, which was the same that we used for Shirodhara. He was having painful jaw movement, so that we have conducted Kabalam with Rasnadi Thailam. As he was having degenerative problems, back pain and knee pain, for back pain we have performed Prishtavasti in the whole spine with Dhanvantaram Thailam and Kedagi Muladi Thailam. And for knees, Pradeshiga Ubanaham with Sahajradi medicines and Gulgulu Tiktagam Gritam also carried out. As if Dushti of Vata in Kapasthana, Pradimarsha Nasyam with Rasnadi Mridupagam was carried out. Snehavasti was done with Dhanvantara Thailam and Kedai Muladi Medupagam weekly once. Pradeshiga Pichu on neck that relieves spasm. Overall, internal and external treatment shows good relief in pain, frequency of tremor and muscular spasm. After successful 6 weeks of treatment, by close examination, we assess the improvement, and also considering the complaint yet to improve, we prescribe the discharge medicines for 1 month, in which there was no much changes in medication, just given in tablet form for easy conveyance. That is Sahajradi Kashaya tablets 2 along with 1 Yogaraja Gulgulu advised to take before breakfast. Kabikachu Churnam in warm water to be taken before dinner, and Sahajradi 21 times medicated oil 6 drops in milk after dinner. Then head oil application, Rasnadi Thailam and Sahajradi 3 times medicated in the ratio 2:1. Ask them to keep it on the head in the evening time by 6 o'clock, and after half an hour it should be wiped off. Then weekly twice morning they can take head bath. Body oil application is again a combination of 3 oil, Sahajradi Thailam, Karpasasthyadi Thailam and Marsha Saindava Thailam in equal quantity, and we advise them to apply it in the evening, then have to take a body bath with hot water. After that only they have to apply the head oil. Then we have given Sahajradi 21 times medicated oil for local application on eyes. After 3 weeks, he contacted us through telephone and he was very happy. He can able to do his daily activities. His confidence level increased. Neck pain stiffness reduced, jerking reduced, 7 to 8 hours sound sleep, knee pain and back pain reduced. Here in this particular case, with minimum medicine we got the maximum effect. Overall, we have given Sahajradi Kashayam, that considering it as a Kevalavada Chikilsa, and Dhanada Nayanadi Kashayam, similar to that, having the symptoms of Ardhida and Akshepaka. In addition, added combinations of Yogaraja Gulgulu for Agni Debanam, Balavardagam and Vadavyadi we used to give. Sajradi 21 times medicated, Kabikachu, all those stimulate the nerves. Brahmana property help for the rejuvenation and stimulating the nerves. Other oil combinations are basically they have the Vadahara property, and in between towards the 10th or 14th day he had severe stiffness, in which Marsha Saindava Tailam had been given internally and externally. That shows much improvement in his condition. Next, coming to the discussion point of view, the Ruksha Guna of Vayu leads to Dhadukshaya. Prakupita Vata is responsible for this disorder. Here, there is an impairment of Vyana Vayu in Urdhva Chatru. Therefore, in this particular case, we have to treat for Dhadu Poshana and Vada Shamana. Internally, we treated with Deepana, Pachana, Balavardhaga medicines along with the Snigdha Sveda Karmas to bring Vada into its normalcy. As per Ashtavaidya tradition, Murdhani Taila plays an important role. As we all know, Murdhani Tailas are Shiro Abhyanga, Shiro Seka, Shiro Piju and Shiro Vasti, in which head oil application we confine to the category Shiro Abhyanga. After examining the patient condition such as chronicity, severity, assessing Dashavida Pariksha, we can decide the head oil. Here we have done Shiro Abhyanga, Shiro Dara and Shiro Piju with the Vadahara Tailas. In the special case, he can't able to sit for nearly 2 hours for Shirovasti due to tilting posture of neck and with pain. So Shirovasti was excluded from the treatment plan. Also, aging was a limiting factor in this case. Treatments like Nasyam, Yogavasti and also Rasayana Prayagas were not carried out. After all these discussions, we can come to a conclusion that our treatment protocol is a collaborative approach of Panchakarma, Ashtavaidya tradition treatments like Murdhini Taila Prayogas, and effective Ayurvedic drugs. Last but not the least, the full cooperation of the patient, that is Bishakvashya. With all these, we managed this case of cervical dystonia without any adverse events. Thank you for your patience. I hope this session was informative, and I thank Vaidyaratnam Group for giving me this opportunity. Thank you.